Good evening, good afternoon, everyone. Today's session is going to be really helpful and it is led by Dr. Ramani Ranjan from Apollo Cradle and Children's Hospital. He's going to talk about loose motions in children's, what to do as parents. So stick around until the end and ask us question if you have any. Doctor, you have stage.
Right. Thank you. I'm Dr. Ramani Ranjan, and I'm working as a consultant in Apollo Cradle and Children's Hospital, Greater Noida. So today we will be discussing a very important topic that we come across on day-to-day basis, and that is about loose motions or diarrhea. And I shall be discussing few important points that the parent should take care of when the child is having loose motions or commonly known as diarrhea as well. So what do we define as diarrhea is basically passing three or more loose watery stools in 24 hours. So usually it's the consistency of the stool which is important. So any change in consistency which is watery is considered to be loose stool or diarrhea. And basically, usually three or more, but even one large stool, especially in few disease states like cholera, can also be problematic. So we have to take care of both the amount as well as consistency of the stool. And there could be multiple causes of loose motions or diarrheal episodes. The most common ones are because of viral infections, especially in infants, and rarer ones are because of bacterial infections. Few uncommon bacteria can cause gut infections. Sometimes it can be because of allergic conditions as well. Having said that, these are not very common ones. The common ones that we come across is mostly viral episodes, and then there is classification sometimes age-wise as well. We have to see what age group the child is in, and accordingly we can discuss about the etiology. For example, passing more than 3-5 stools for a newborn may be normal as well, because the newborns in the initial first few days are little what we say deficient in an enzyme called lactase, and therefore they do not tend to digest the component lactose of milk, and therefore they tend to have little runny and watery stools. But it is actually not diarrhea or loose stools. It is very much physiological and normal for that baby. So we should not be in a hurry to treat that. And there are many parameters that needs to be taken into account before we want to treat loose motions or diarrhea. So depends upon the age of the child. How age is the what's the age of the child? So newborns, as I say, the frequency is on a higher side, and as the child grows, the frequency will get better and better. The milk handling will get better, so you will see a decrease in frequency of stools as well. Somewhere around 6 months, when child starts taking home-based food, that means the weaning is started. Then is the time when the child may have episodes of loose stool. Some people feel that teething can also kind of exacerbate loose motions or something, and that is because of the saliva that gets or the amount of oral secretions that goes into the tummy that can actually lead to little runny stomach. So, and then, as I say, in infants, we have loose motions because of uh, viral episodes. Some children who are bottle fed can have gut infections very commonly, and that could be because of bacterial infections, because bottle feeding is a source of infection. And if the hand washing is not taken care of, the way we prepare milk, the overall hygiene, if it is not good, then the child is in I mean, the child is more likely to have bacterial episodes of loose stools. And then, very rarely, allergic conditions like cow's milk protein allergy and some other rarer conditions can also present with loose motions or diarrhea. Having said that, in most cases, it is self-limiting. It usually settles down within 3 to 7 days, and in most cases, we do not have to use lots of medicines for this. And the most important thing that we want parents to take care is to take care of the hydration. That means replacing the ongoing losses. So whatever volume is being lost in the stools or through the vomiters has to be replaced, and the best rate for that is called ORS or oral rehydration salt, which is a WHO recommended formula. So when we purchase ORS, we have to make sure it's a WHO ORS. That means it has been approved, pre-approved by WHO, because the composition of WHO ORS is very important. It has got the right blend of electrolytes, sugar, salt, and everything, so that it mimics the fluid which is being lost. So other fluids like giving juice or glucose, cold drinks, this will not help. In fact, it might worsen the situation. So the best fluid to replace the ongoing losses is ORS. Uh, Apart from ORS, home-based fluids like dal ka pani, chawal ka pani, coconut water, shikanji, um, lassi, salted lassi, and very less salt and a little bit more of sorry, less sugary, a little bit of salt containing namak chini ka ghol. Is tarah ki cheezein we can offer the child along with that normal water as well. So this will make sure that the child is well hydrated. And depending upon age of the child, there is a role of what we call zinc supplementation. So zinc is given to kids to help the diarrheal episode. So इससे diarrheal episode कम होता है, and there is chances that it might not happen again in next 3 months. So it also protects the gut from future episodes. So zinc and ORS is the most commonly and most, I would say, efficient way to tackle loose motions or diarrhea in children. Having said that, you must understand that there is a dose of every medicine. So zinc has got a dose. ORS कितना देना ये भी बच्चे के weight के ऊपर निर्भर करता है. Usually we say less than 2 months, 25 ml is good. 2 months to 2 years, somewhere around 50 to 100 ml. More than 2 years, we want 100 to 200 ml. And bigger children can take more than that. Usually not more than 2 liters in 24 hours for bigger children. So ORS is the most important thing. How to prepare ORS? इसमें अलग अलग formulations आते हैं. There is a 1 liter sachet, then there is a 200 ml sachet. और आजकल market में we have got what we call ready-made Tetra Pak ORS as well, which is already ready to drink. So we do not have to mix it. So whichever formulation you are using, you have to make sure you are preparing it hygienically. And secondly, it's very important that you abide by the instructions given on the sachet itself. So अगर 1 लीटर का sachet है तो पूरे 1 लीटर पानी में उसे dissolve करना है. 200 ml का sachet है तो 200 ml पानी में ही dissolve करना है. If you do not adhere to the ratio of water and ORS, then the resultant solution is actually not the ideal ORS. So it may be not as beneficial, or sometimes if it is too concentrated, it may be harmful as well. So yeah, it's very important to stick to the correct proportion of water and ORS, oral rehydration salt powder आपके साथ है ना. And amount we have already discussed. So every loose motions which you think is watery, we should replace by giving ORS to the child. So this is the most important part of treating loose motions, yeah, diarrheal episodes in children, especially less than 2 years. Now coming to role of other medicines. So most of the times, as I said, we do not need antibiotics. Antibiotics are needed when we feel like there is chance of bacterial infection. Bacterial infection, for example, agar blood hai, if it is very smelly and the child is unwell, the child is having fever and other symptoms, which kind of point towards bacterial infection, then we may have to think of antibiotics. But as I say, mostly it is not required. In many cases, even bacterial infection becomes, self-limiting, and it gets better in 3 to 5 days. So the most important thing is to start ORS. Do not self-medicate. That is very important. अपने मन से आप antibiotics start karna is not helpful, because if you give antibiotics, then actually things might go other way around as well. The body might develop, bacterial resistance. The gut microflora may change. So actually, diarrheal episodes may last longer. So, जहाँ ज़रूरत है, doctor will decide whether the child needs antibiotics or not. It's always not a good idea to self-medicate with antibiotics. And as role of food items, we say that something like khichdi dalia, banana curd is good, yogurt is good. These food items can be offered to child who is more than 6 months of age, and along with that, we have to make sure that we should avoid juice, we should avoid cold drinks, we should avoid fluids which are very sweet, for example, glucose, because of hyperosmolar nature of these fluids, it will draw more water from the gut, and the loose motion episodes might actually increase. It's not a good idea to offer a very sugary drink to a child who is suffering from loose motions. Normally, home-based foodstuffs, whichever we consume, is okay to give to the child, provided there is no vomiting. If there is any vomiting, then we should take care of the vomiting part as well by offering some of is the overall well-being of the child. Is the child active or lethargic? Is the child eyes are appearing sunken or not? Whether there is saliva in the mouth, whether the tongue appears dry or not? How is the urine output? How eagerly the child is able to feed and take oral drinks. So these all parameters are very important when we talk of management of diarrheal episodes. If the child is active, if the child is drinking well, the urine output is good, usually it's not concerning. On the opposite, yeah, if I say that the child appears dehydrated, the child eyes appear sunken, you do not see any tears or saliva, or the mucous membranes, the inside mouth appears dry, the child is sleepy, the child is passing less urine, so there could be signs of dehydration, and we should get in touch with the doctor immediately, because such children in advanced state of dehydration, or we say severe dehydration, might need IV fluids as well. So do not self-medicate. If you are in doubt, always see the doctor and get the assessment done, whether the child is in any state of dehydration or not. So the take-home message is that we have to understand that diarrheal episodes are fairly common in the infancy and first few years of life. Hygiene plays a very important role to get rid of bacterial infections. Bottle feeding should be avoided as much as possible. Exclusive breastfeeding for first 6 months protects babies from loose stools and similar infections. And we have to take, if we are bottle feeding, or if we are giving formula feed, we have to make sure the formula is prepared in the correct manner in a very hygienic situation. Try katori, spoon, or palette feeding in place of bottle feeding. And if you are not sure, please always do see the doctor for assessment of diarrheal episodes. ORS is the appropriate and the most important fluid in the management of and diarrheal episodes. Zinc is given as an adjunct drug to help with the diarrheal episodes, to decrease the duration of the existing illness, and also to prevent the future attacks as well. एंड वी हैव टू मेक श्योर विद दी क्लिनिकल पैरामीटर्स घर पे जो हम मॉनिटर कर सकते हैं, जैसा मैंने बताया कि बच्चा एक्टिव है नहीं है, यूरिन आउटपुट कितना है, आई संकेत तो नहीं है. दीज आर ऑल थिंग्स टू बी मॉनिटर्ड एट होम. सो आई थिंक दिस इज इट फ्रॉम माय साइड, एंड इफ देयर आर एनी क्वेश्चंस वी शैल डिस्कस. Fine, I can't see any questions. So if there is any question, if you want to discuss, and we are more than welcome to come to my hospital. I am in the basement, and we can discuss about these episodes if you find necessary. So thank you very much for your kind and patient hearing, and thank you for joining me for today's session. Hope to see you soon with some other important topic for child care. Thank you very much.